Your primary care doctor was right. The mass is on the smaller side. We'll confirm with the new images, but it should be manageable with medication. No surgery needed.
Well, my fiance will be so relieved. He's worried I'll look like Frankenstein in all our photos. Also that I might die.
When's the big day?
June.
You've been dealing with wedding planning on top of a pituitary tumor? You deserve a medal.
Our medical record system, on the other hand, it has you listed as female.
Probably because of the pap smears.
Software clearly needs a trans update. Deep breath.
I'll fix it so everything is correct going forward. Please confirm your gender and pronouns.
Male, he, him, his. Thanks for asking.
We're the ones with the messed up software. Your scans from this morning were just uploaded. In less than 2 weeks, the tumor's doubled in size.
You're just too good to be true. I can't take my eyes off of you. You be like heaven to touch.
34-year-old female, Laura Norton, tachycardic and delirious.
Dr. Guerin, update vitals. Dr. Walt, draw bloods for CBC and electrolytes.
Now that I found you.
Pupils are dilated but reactive. Miss Norton, smells like you've had some marijuana.
I just unloaded a shipment at the dispensary.
Test for THC and a full tox screen.
I am a peddler, not a user.
Run it.
BP's elevated 180 over 115. That could explain the delirium.
Oh, that sound high. Better take my meds. See, I never miss it. Oh, no. Oh, no, that's not it.
BP's climbing, 210 over 120.
And a Lapro at 1.25 milligrams IV.
Miss Norton, do you remember the name of your medication?
Call me Zara. See, it say it right here on the... Ooh.
Okay, forget about the meds. She's not taking any. This is untreated chronic hypertension.
What if you're wrong? What if she's on a loop diuretic with her pressure? This could cause renal failure.
She's heading into hypertensive crisis.
What if you try an angiotensin receptor blocker? No drug interaction.
Angiotensin receptor blockers work too slowly. I'm giving her the ACE inhibitor.
BP's going down. Nice call.
We need to do an echocardiogram to make sure your heart wasn't damaged in the crisis.
Fine by me. Here's 10% discount on any purchase of $50 or more at Z and B Naturals. I'm C. B is my partner, Bill.
You're surrounded by pot all day, every day, but you never touch this stuff?
How? Why?
It's just never been my thing. The name always trips me up.
Chlorothalidone.
That's for hypertension.
Yeah, the bottle seems pretty full. How long have you been on this?
About 6 months, just refilled it. Take it every day.
Would you mind if I did an ultrasound on your abdomen?
For a brain tumor?
This is my fiance, Eli Simpson.
When I heard about the new scans, I kind of stormed the castle.
My hero.
Your prolactin levels are very high, which might be caused by the tumor, unless another condition raise your prolactin, encouraging more growth.
What condition boosts prolactin?
Do you think I'm pregnant?
He can't be. He's on testosterone.
Except for a few weeks last month. I forgot to take my shot before our trip. But there's no way that...
You're pregnant.
You went into cardiogenic shock because your heart wasn't pumping adequately. We did a minor procedure and installed an Impella pump, but it's a short-term solution.
I do feel a little out of breath, but that might be just because of you, Dr. Andrews.
Ms. Norton, I'm a married man and your doctor. You have a rare condition. Certain parts of your heart muscle have become abnormally thick. So this wall in between the chambers, that's the septum. That's a normal one. This is what yours looks like.
Wow.
It's going to require surgery. We're going to run a few more tests to determine the best approach.
Wait, you gonna be my surgeon, Dr. Andrews?
I sure will.
And y'all two gonna be with him?
Yeah.
My lucky day. 3 doctors of color taking care of me. Doctors who won't talk down to me. Not exactly what I'm used to. You guys know what I mean.
My mother made me wear a suit and tie whenever we went to the pediatrician.
But on your Sunday best just to get on the scale and touch your toes.
Yeah. Made me so mad I wound up becoming a doctor.
The testing confirmed your tumor is a hormone-producing prolactinoma, and the pregnancy is about 6 weeks along.
Do you consider yourself gay?
I don't think that.
Yes, because I am gay.
But you have vaginal intercourse with your fiancé. That is how he
Dr.
got
Murphy,
pregnant.
that's enough.
Yeah,
I think you should leave.
I just want...
I'm sorry. That was completely inappropriate. Our treatment plan for your tumor depends on your plan for your pregnancy. So.
We've talked about kids, but I always figured that was way down the road.
Not this way. I always assumed we'd adopt. I'd have to go off T and stay off.
If Rio doesn't continue the pregnancy, then what happens?
Your hormone levels would drop quickly, which would cause the tumor to shrink. After that, we'd use medication, possibly a minor surgery.
I'd like to terminate the pregnancy.
Nurse paged me. Is something wrong?
I've changed my mind. I want to keep the baby.
Since you're continuing the pregnancy, we'll need to surgically remove the prolactinoma.
So you'll cut into his brain.
Our safest option is to go in through the nasal cavity in what's known as a transsphenoidal surgery, TSS for short. It's less invasive than our other option.
That still sounds dangerous.
I've made up my mind.
Do I get any say in this? I'm all for us having a family, but I'm not ready to...
No one's ever ready for kids.
Yesterday you said that you never considered getting pregnant, and now you're willing to risk your life for it.
When I was about 7, I had this one refuge. I'd hang a quilt over a couple chairs and hide out with my 2 buds, Foxy the Fox and Fuzz the Lion. And I'd imagine I was the dad, and they were my twin little guys. Fraternal, obviously. We were a family. When I transitioned, I put that dream aside. At least as far as them coming from me. But now, whether we planned it or not, this is our baby. How soon can you do the surgery?
I'll order an image guidance MRI to get things started.
Based on the cardiac MRI and catheterization, there are 2 treatment options. Myectomy, basically open heart surgery, and alcohol septal ablation, where we use the alcohol to kill targeted sections of the heart muscle.
But what would you recommend?
This surgery is more invasive, tougher recovery, but better efficacy long term. The ablation is less dangerous, but you are more likely to need further medical interventions.
Now, you call that a recommendation?
There are pros and cons to both. You'll need to weigh them. I'll give you some time.
You always want to take care of people, Dr. Brown?
Pretty much.
Me too.
You run a marijuana dispensary.
It's not all about getting people high.
No, maybe not. But I'm guessing most of your clientele...
My great aunt Lucy had pancreatic cancer. A year she hung on. In agony. Marijuana was the only thing that helped her eat or sleep.
Doctors didn't give her anything for the pain?
They suggested ibuprofen. Now, you know doctors are 22% less likely to give pain meds to black patients than to white patients with the same symptoms. My point is, you and I were a lot alike. We're both strong black women finding our way in the world, but one of us knows more about medicine than the other. So, I'd like to know, what would you do in my situation?
The open myectomy is a bigger risk, but offers more long-term benefits.
I made my decision. I'm with you, Dr. Brown. Book the myectomy.